One of the good things where God don't do for us now, say we fit go piss for toilet. Yes, so welcome to Health Corner on top Good Morning NAIJA show. We don't yarn you about the kidney infections and the things where they cause them. We don't begin talk yesterday about some of the symptoms of this kidney infection. And the first one where we mentioned, I say, say at least half of women, they don't experience this kidney infection at one point for their life because of their urinary tract as God take do the urethra. Well, one of the things where they happen, I say, it is very painful, it is urgent, and you go they want they go toilet quick as in to go urinate. That's now one of the symptoms where they happen. And this pyelonephritis, if it starts with the same thing, pyelonephritis and the kidney infection, if it starts with these same symptoms, but when the thing don't spread, when the infection don't spread, go meet the kidney. There you go, they experience some kind severe gbege, as in plenty gbege for inside body. And one of them now, the same frequency, that now, the number of times where you they go toilet go increase. The number of times where they go urinate. And when you even go, it go be like say you not feel whole up. Another one now, diarrhea. That now, when it be like say, when you go toilet, you go they pass water stool, and you go toilet maybe like 6 to 7 times or even more for some people. Then your temperature fits high well, and this normal temperature now between 34.2 to 37.4. And if that one no, if it pass them like that, you don't enter, be careful. So if you don't they get like 38 degrees centigrade or above, that one now say it fits be this pyelonephritis they do you. Another one now nausea. That night they do you like say you won't go vomit, but some people they go even vomit. Then some go they shake where their body, they go they shiver, they don't feel control themselves. Then some people, in fact, if you don't enter very serious case, they will come they experience back pain. And this back pain now, mainly because of the infection where they affect the kidney itself. Some people could have experience pain even for their down below, then pain for the side. That's now for the kidneys themselves, go. And if your doctor examine you, that's now why they feel pain for your side. Then sometimes the symptoms fit worsen when patients they urinate. Unto say there fit be bladder infection where join on top this kidney infection. They call this one cystitis or urethritis. And the person fit begin they see some kind of things like blood for inside the urine. Then the urine go they like say they cloudy, go they white, one kind no go clear where. Then you go they experience what they call dysuria. That now pain or difficult urination. When you they go piss, the thing go they pain you. Some people go they experience some kind of burning or stinging sensation. Would be like say the thing they pepper you. Then some people their urine go they smell person not fit even if you use toilet finish, you go be like say you throw a bomb for there. Then sometimes this frequent urination where we don't mention before, you won't go past, be careful. If now 6 to 7 times another person they do your own feel it like 10 to 12 times. Then another one be say you know go fit come out your piss where when you piss finish, you go be like say you never empty your bladder well. Plus on top that one, you fit still the experience some kind of pain for your lower abdomen, that's not the lower part of your belly. Well, we don't talk about some of the causes of this kidney infection, and most of the time, the bacteria where they cause this pyelonephritis or kidney infection are the same as those where they affect the ordinary urinary tract. They cause urinary tract infection, that's not UTI. Bacteria where they find for stool will be like Escherichia coli or the one where they call Klebsiella. Now them be the most common. Well, the one way not too common are bacteria where they from our skin or from the environment, from outside, if you cause them. Then you get some kind of conditions where they create reduced urine flow. You understand? As in some kind of diseases, gbege where you go get for your body, where they make the way where your urine they come out, not to they come out well. And these ones, they cause, make person, they get this pyelonephritis. So for example, when you they piss and the thing they flow small, or they stop, bacteria fit travel through the ureters, go enter inside, cause urine obstruction. You understand? Because they flow normal. Bacteria were supposed to come out one time, will just take their time, they go inside. And some of the conditions where when this thing they happen, now one way they call benign prostatic hypertrophy. This now when the prostate they big, but the wahala where they inside not too much, they feel correct them. Another one now abdominal or pelvic masses where they result from cancer. If you get cancer, you can notice say that one form big mass we go dey inside, they block as urine they take the pass. Then if you get stones inside your bladder, like kidney stones where they talk, or for the urethra, or for inside the kidneys themselves, this one fit contribute to the causing of this pyelonephritis, aka kidney infection, because they allow bacteria to grow inside the body, come make sure say the soldiers where they fight infection, they weak. But now here I go bar break on top the matter. Tomorrow I go give you some other things wey concern this kidney infection, even how to prevent them. Apart from that, how you fit treat them if you discover say you don't get them when you go see your doctor. My name is still Dr. Adora, and this is your health corner on top the Good Morning NAIJA show. I go see you tomorrow.